All right. Welcome for folks who just joined. For folks who've been on the line with us for a couple of minutes, I'm so sorry, but you're going to have to hear my intro spiel again. My name is Chelsea Rivas. I am the district director here for Congressman Greg Stanton. And welcome to all of you who are joining us. We are thrilled to have with us some subject matter experts to talk about Medicare open enrollment and some of the things that are weighing heavily maybe on your mind, particularly at this time of open enrollment. There's, as you know, only a couple more days left in the open enrollment season. So I am going to hand it over to Jeanette Marsh. Jeanette is going to give kind of an overview of what we're going to be talking about over the next several minutes together. And if you need anything, please use the chat function. You're welcome to submit questions there or ask anything that you need to. All right, Jeanette.
Hi there. Thank you. Thank you, Chelsea. So my name is Jeanette Marsh, and I am joined by my colleagues here in the San Francisco Regional Office. We are Region 9 that encompasses your state, as well as California and Hawaii and some of the Pacific territories. So we have on today presenting on Medicare overview is my colleague Peter Bauer. We will have other colleagues speaking to current campaigns. And then as soon as I'm done speaking, I will turn it over to our regional administrator, Derek Lamb. And there's also another colleague on the call, Sharon Yee. Both Sharon Yee and myself are your congressional liaison that work directly with the congressional office for any constituent issues you may have specific to Medicare. And so I want to start off by prefacing, thank you so much for providing your questions in advance. It is possible we may not get to every single question. And then as each of us go through each of our respective presentation, we may actually end up answering your question in that presentation. So just bear that in mind. If we don't end up getting through to every single question, I want you to keep in mind that there is local resource in your area that Chelsea just put on the screen, and it is called the Area Agency on Aging. And this particular one is landing on, your area and your county, so that if you can't ask us questions today, we encourage you to reach out and contact them. And it's possible that they can sit down and have one-on-one counseling with you if you have a particularly nuanced or navigating a lot of information that you want to sit down with somebody who is an expert at what's available in your area, along with Medicare's latest changes. So please bear that in mind. So having said that, I'm going to turn this over to our regional administrator, Derek Lamb, to do some introduction. And then after Derek speaks, then we're going to launch into Peter's presentation.
Thank you so much, Jeanette. And also a big thank you to Congressman Greg Stanton for inviting the whole team to be here this morning and to share with you the Medicare open enrollment period and also Medicare 101. Again, my name is Derek Lamb. I'm the regional administrator and staff director for CMS San Francisco. I lead and coordinate local engagement efforts with all regional stakeholders and customers, as Jeanette mentioned, the beautiful state of Arizona and also California, Hawaii, Nevada. And for the Outer Pacific, we have American Samoa, we have Guam, and also the Commonwealth of Northern Mariana Islands. And I also provide administrative and operational support to all employees in CMS San Francisco with a notion to promote cohesion and collaboration throughout the regional office and with other CMS components. So today we are going to spend some time talking about open enrollment, which Peter Bauer, one of our subject matter experts, is going to do that. He is also going to cover Medicare 101. And then followed by Janelle Herndon, another subject matter expert. She's going to talk about what you should know about the flu, the COVID-19, and RSV vaccines. And then we have Christina Colasso, another subject matter expert, and she's going to cover the areas in the space of free COVID tests, Inflation Reduction Act, and also Medicare prescription payment plan. So why are we talking about the Medicare open enrollment? Because this is going to offer over 67 million people currently enrolled in Medicare the opportunity to review their healthcare coverage and to determine if they still meet their needs. So Medicare beneficiaries are really encouraged to review the existing coverage, whether it is original Medicare or Medicare Advantage, to determine if they need to make changes that will be effective January 1st next year. This open enrollment period also offers beneficiaries the option to review or change the current Part D prescription drug plan. So without further ado, I'm going to turn over to Peter. So he's going to walk you through the Medicare 101 and also the open enrollment period. So over to you, Peter.
Thank you, Derek. Yeah, so this is right now, we're right smack in the middle of Medicare open enrollment. And that is the period of time between October 15th, so right currently in the middle of it, going through Thanksgiving all the way to December 7th. I would take this opportunity just to emphasize, double down on what Derek said, is the official source for this information to find the plans that work best for you is at medicare.gov or by calling 1-800-MEDICARE 24 hours a day, 7 days a week for the official government sources for all things Medicare. Comparing drug and health plan options is easy on medicare.gov because you can get a list of prescription drugs you're taking and do a side-by-side comparison of the costs and the quality ratings of the plans. If you're happy with where you're currently, with your current source, your current choice, you don't have to do anything. But if you want to choose a new option for 2025, you can enroll right there at medicare.gov. Remember that the plans change every year. Even your current plan may be changing. Your health needs can change also. And so by comparing your options, you could be saving a lot of money and find better coverage. If you need assistance, and let's say you don't have the ability to get to medicare.gov, please feel welcome to call 1-800-MEDICARE. Again, it's 24 hours a day, 7 days a week, to get free personalized health insurance counseling in your community. You can call the Area Agency on Aging, or if you don't, if you have a friend who is not on this call and who's not going to watch the recording of the call, you can have them call 1-800-MEDICARE and ask for, hey, I need to have some local help, and they will get the local. They'll be able to patch them into the local Area Agency on Aging to give them local help. I'm also going to take just this moment to understand this is called, I call this the Medicare 101 portion, is the two main ways to get your Medicare coverage is through original Medicare or Medicare Advantage. And there's differences between the two that I'll quickly go over. And it's important to understand those choices when you're choosing your coverage. And remember, before you roll in a plan, consider the following things: the network of healthcare providers, the formulary of drugs that you're actually taking, the star rating, which is available on 1-800-MEDICARE and also on medicare.gov is seen, and I'll talk a little bit more about that, and the costs of the plan that you want to enroll in, including the fine print, like what's the premium, what's the deductible, and what are some of the other out-of-pocket costs. So there's two main ways to get your Medicare coverage, either through original Medicare, you get your health care through Medicare Parts A and B, and you can join a separate drug plan to get Medicare drug coverage called a Part D plan or Medicare prescription drug coverage. And you can see any doctor that takes Medicare anywhere in the United States. So a lot in Arizona, a lot of our winter residents take advantage of the original Medicare program. Medicare Advantage, again, the way Medicare Advantage plans work, so your choice is either do a Medicare Advantage or sign up with a Medicare Advantage plan. They bundle your health and drug coverage all into one plan. And they may offer extra benefits that Medicare doesn't cover, like vision, hearing, and dental services. In many cases, you can only use the doctor network the doctors that are in the plan's network. So the Medicare open enrollment period is, again, I said before, October 15th to December 7th every year. It's an opportunity to make the changes to your prescription drug or health plan coverage. And the time to compare your options and find the right plan is right now until December 7th. So I'm going to ask you that in your mailbox, you will have gotten, if for your current Medicare Advantage plans, the annual notice of change, or ANOC, A-N-O-C. And that way you open up the letter. It's very important. It pencils out your rights on the back page, but it also will give you a sneak preview of what the costs are going to be next year, the benefit and coverage rule changes, the drug formulary, the list of covered drugs that the plan covers, and the networks, including the preferred pharmacies. Again, this ANOC, or annual notice of change, comes to your mailbox by November 1st, so you already should have it, and it gives you on paper your rights, but also what the plan that you're currently in is going to look like next year. So during this open enrollment period, you can pick a new Medicare Advantage plan. You can join a new prescription drug plan to get your medications. You can switch from original Medicare to Medicare Advantage plan, or you can switch from Medicare Advantage to original Medicare, but with or without a Part D plan, because you'll have to also, if you go to Medicare, you can choose to be on with a Part D plan or not enroll in a Part D plan. And then all those changes would be effective January 1st, 2025. So I would like to just go real quickly through Medicare Advantage considerations. Please review the plan's estimated total costs to you, including the premium, deductible, and other out-of-pocket costs. If the Medicare Advantage plan offers extra benefits like vision or hearing or dental coverage, see if your healthcare providers are in that plan's network. Check the star ratings to see how Medicare and other plans, how other people with this plan like it. And then understand how the plan works with any other coverage you may have, any group health plan in retirement that you may have. Also, remember how I was talking about original Medicare? A lot of people in Arizona sign up for a Medigap policy or a Medicare supplemental policy. These are sold by private insurance companies. It fills the gaps in original Medicare coverage, like co-payments, co-insurance, and deductibles, and they work nationwide. Each standardized Medigap policy under the same plan letter must offer the same benefits no matter which insurance company sells it, but realize the costs may vary. Another type of Medigap policy is called Medicare Select, and is available in some states. I happen to know that it's available on both 2 states on either side of you, New Mexico and California. It's a pretty popular product, but the deal is that you need to sign up for, if you sign up for Medicare Select, you can get some savings, but you also need to pay attention to the network that the Medicare Select works with in order to enjoy the savings of the Medicare Select policy. So one of the decision points, do I even need one of these Medicare supplemental policies? Well, it only works with the original Medicare, right? Yep. What if I have another supplemental coverage, like from an employer? Then you probably don't need Medigap or Medicare supplemental policy. Can I afford Medicare deductibles and co-payments? Weigh this against how much the monthly Medigap premium costs, and what does the monthly Medigap premium cost? It can vary depending on the insurance company. The Part D considerations for prescription drug coverage is look at the estimated total cost to you, including the premium, deductible, and cost sharing. Review the formulary to see if it covers your drugs. Check to see if the plan has restrictions like prior authorization, step therapy, quality limits, and see if your pharmacy is on the plan's preferred network. Or if you're a mail order person, see if mail order is available. And also, please check the star ratings to see how the plan is rated. Understand how the plan works with other coverage that you may have. And I was going to do a time check. Jeanette, am I okay, or do you want to start with the questions?
Why don't we jump to some questions now?
Okay.
And as I prefaced earlier, we may not get through to every single one of the submitted in advance questions. And then some of them are similar enough that, I will ask at the same time. And also Peter also had addressed some of it already. For example, how do I know what supplement plan is for me is one of the questions. Well, Peter did specify that on the Medicare .gov website, there is the plan comparison plan finder. So right off the bat, that answers that specific question. I'll take the first question, which is, I will be turning 65 in September. When do I need to enroll in Medicare? So I'm not sure if this means September that just passed or upcoming September in 2025. But generally, we speak to this as you have, if you are about to turn 65, you have a 7-month period that is your initial open enrollment period. 3 months prior to you turning 65, the month that you turn 65, and then 3 months after you turn 65. Now, if you want it to be active the month of your birthday, then please do that. Begin the process 3 months before, so that you have it timed perfectly. Otherwise, then you could still do it within that 7-month window after you turn 65, but it's just the start date will then be pushed out. And then otherwise, then, you have to wait till the following open enrollment period. So that answers that specific question. So Peter, the next question is, I have a hard time understanding Medicare Advantage versus plain Medicare with a supplement. And then similarly to another question, want to know the difference in Medicare Advantage and Medigap. So those two questions are related.
Okay, so that's kind of why I wanted to go through that first monologue about original Medicare is your Medicare A and B, and so that means you can, and it works throughout the United States for any doctor who takes Medicare. And usually those people who have original Medicare usually have a supplemental plan, which also allows them. So that's really popular in a state like Arizona, California, New Mexico, because a lot of people are winter residents. They're there during the fun time to be in Arizona, and then but they have to find a doctor who takes Medicare and be able to get their service. The way advocates always explain it as far as what's Medicare Advantage. Medicare Advantage is you're signing your Medicare over to the Medicare health plan, which is administered by an insurance company. And so you're receiving your Medicare through the Medicare Advantage plan. So that's how I try to explain it to people, is that you're still on Medicare, but you're choosing to be with a Medicare Advantage plan. And so when you choose one of these plans, just please look at does the provider network that you want to be in work with at the hospitals that you work with that you want to go to? Are they in that plan? And also do the same due diligence as far as the pharmacy and where they do mail order, all those decision points. And then also take a look at the quality rating, see what other people on Medicare think about that plan last year. Did they provide good service to people? Are they popular? And then also informally maybe ask over the Thanksgiving table, ask your friends and family members what's up. I'm thinking about jumping to this plan. It looks good on paper. What do you think? Have you heard anything? And then try that. I don't know, Jeanette, did that kind of
Yeah, and
pencil it
and
out a
the
little bit
same
better? Or
in the same vein, this question is related to. I have a standard Medicare and a supplement. Is it true that if I give up and go to an HMO or PPO, Plan C, that I can never go back to the standard Medicare again?
You do have some rights in this matter, and I will have to get Chelsea the site on it. There is some rights in this matter to try out Medicare Advantage for a period of time, and then say, it didn't work out. I want to jump back, and I want to go back to my Medigap policy. So there's a trial period, but I will have to I'll have to dig that out. But generally, let's say you switch over to Medicare Advantage, you've been with Medicare Advantage 2-3 years. Now you want to go back to your old policy because let's say are visiting a bunch of different states, and you want to, for one reason or another, you want to get back to what you had. There is no going back, unfortunately. But there is a trial period because we do want to have people check it out, but then be able to get back. So I will see if I can get Chelsea that. You're giving me some homework.
Okay. So at this juncture, we're going to turn it over to Janelle to speak about current campaigns. Thanks, Janelle.
Everybody, my name is Janelle Herndon, and like they were saying, I am also part of CMS San Francisco. And today I'm going to be giving some just reminders about immunizations, vaccines, and kind of giving the what's new for this season this year. So as Jeanette was saying, this presentation at this current time is current, but the information can change. So while respiratory virus activity is currently trending low to mild throughout the country, the CDC anticipates that this will change. Peaks of respiratory disease usually happen between December through February, and several respiratory viruses spread especially more during the fall and winter, including flu, COVID-19, and RSV. The holidays are coming up. Large gatherings are expected. There's going to be a lot more travel. And especially with time indoors with friends and family, this could mean, unfortunately, more virus spread. So I'm here to just remind you that there are prevention strategies that we can use to kind of mitigate the spread of flu, COVID-19, RSV, such as hand washing, masks if you feel like you are ill or if you're immunocompromised, and then vaccines. Older adults and young folks, like babies and infants, and then pregnant women are especially at risk. So if you fall in those categories, we highly recommend, hand washing, masks, and vaccines. Vaccination is a cornerstone of preventing illness, especially those key diseases that we talked about. And there have been updated vaccines this year for the flu and the COVID vaccines. And then for RSV, it's the same vaccine, but we are just recommending it because it does tend to come up during the season. These vaccines, like COVID-19, are free for Medicare, Medicaid, and Marketplace or Affordable Care Act beneficiaries. And then RSV vaccine is covered by Medicare Part D, Medicaid, and Marketplace with no cost sharing. So, and again, just want to highlight that, especially for those that are pregnant or for those that are infants or have infants and young ones, you especially want to get these vaccines. Most folks only need one dose of the flu vaccine each season. So if you already got it earlier this year, you should be good to go. For the RSV vaccine, either the infant can get the vaccine during through the mother during the pregnancy or shortly after birth. There's also an updated COVID vaccine through Pfizer, Moderna, and Novavax, which is currently helping with the circulating strains and are recommended for everybody age 6 months or older. And I know I'm going through these slides relatively quickly. There is a resource that will be handed out that explains a little bit more in detail about ages and recommendations, as well as where to find resources for the vaccinations as well as coverage. And then this is speaking to those RSV vaccines. It's also recommended for adults over 60, especially those with chronic conditions, not only those that are expecting or young ones. Lastly, I want to cover I want to reiterate that because of the Inflation Reduction Act, the vaccines recommended by the Advisory Committee on Immunization Practices have included a lot of vaccines that are now covered under Part D and also Medicaid. So there are other vaccines that if you were thinking about getting them, for example, shingles or Tdap, which is tetanus, diphtheria, and pertussis or whooping cough, those are again are covered under Medicare Part D. Other ACIP recommended vaccines also include hepatitis B and pneumococcal. And then if you would like to get COVID-19 tests, you can go to covidtest.gov. This site is going to be open until December 31st of this year. And if you order them by the end of the year, you will receive 4 free over-the-counter COVID tests direct to your home. So you have until December 31st to order the current COVID-19 test. So that is it as far as immunization and vaccination recommendations and reminders. I'm going to be passing it on to Jeanette and Christina.
So far, we could move on to Christina while I have questions when she's done with her portion.
Okay, thank you, Jeanette. So it's a pleasure to be here today and talk to you about the Inflation Reduction Act. Through this new law, this is the new Medicare prescription drug law, and this is increasing access and affordability for Medicare prescription drugs. So with the new law, Medicare now negotiates drug prices directly with manufacturers, and this is to ensure that people with Medicare pay lower costs on some of the costliest prescription drugs. So in 2023, we selected, and in this year, actually 2024, we negotiated the first list of 10 drugs. So the law now requires that those 10 drugs are chosen from a list of the highest spending brand name Medicare Part D drugs. And the negotiated Medicare drug prices for these first 10 drugs will be available starting in year 2026. And then after that, Medicare will choose and negotiate 15 more Part D drugs. Those prices will take effect in 2027. Then 15 more Part B and Part D drugs for 2028, and 20 more Part B and Part D drugs for each year after that. So this negotiation process is an ongoing thing. And manufacturers that don't follow those negotiation rules for those selected drugs will pay a tax and a penalty if they don't fulfill other manufacturer requirements. So this new law is also benefiting people with Medicare by a redesign of the prescription drug program. So one of the more popular provisions people may already be aware of is the monthly cap on Medicare covered insulins. So someone with Medicare who takes insulin covered by their prescription drug plan or through a traditional pump under traditional Medicare will have access to each of those covered insulins for no more than $35 for a month's supply. And so that person won't pay a deductible for their covered insulin products. And so this change sets a cap on insulin cost sharing it's expected to benefit at least 1.4 million people with Medicare. Another change through the prescription drug law is the expansion of low-income subsidies starting in 2024, so in this year, So this is for certain individuals with limited income and resources who earn less than 150% of the federal poverty level. And so this change will help people enrolled in Medicare drug coverage be better able to pay their premiums and cost sharing to fill their prescriptions. And then also starting in 2025, people with Medicare prescription drug coverage will benefit from a yearly cap of $2,000 on what they pay out of pocket for their prescription drugs. And then another program that is being implemented in 2025 is something called the Medicare Prescription Payment Plan Program. So this is an option to pay your prescription drug costs in monthly amounts spread over the course of the calendar year rather than all at once at the pharmacy. And this again is beginning January 1st of 2025. So this Medicare prescription payment plan is a new option in the prescription drug law that works with your current drug coverage to help you manage your out-of-pocket Medicare Part D drugs by spreading them out over the calendar year. So that's January through December. And then so starting in 2025, anyone with a Medicare drug plan or Medicare health plan with drug coverage, like a Medicare Advantage plan that has drug coverage, can use this payment option. And all plans offer this payment option, and participation is voluntary. So there's no cost to participate in the Medicare prescription payment plan program. And so you're most likely to benefit from this program if you have high drug costs earlier in the calendar year. Although you can start participating in this payment option any time of the year, starting earlier in the year gives you more months to spread out your drug costs. So you can visit your plan's website or call your plan to get more information. If you need to pick up a prescription urgently, then you can call your plan to discuss your options. And also the State Health Insurance Assistance Program or your area agency on aging can provide free personalized health insurance counseling to see if this payment option is right for you. And then finally, if you know people who have marketplace coverage, the Inflation Reduction Act continues to lower health insurance premiums through healthcare.gov and state-based marketplaces. So many consumers will benefit from lower healthcare coverage premiums through 2025 on healthcare.gov and state-based marketplaces because the new law, the Inflation Reduction Act, extends the enhanced financial help that was put in place by the American Rescue Plan Act. So enhancing this and extending these subsidies mean many consumers will have health insurance through healthcare.gov, and state-based marketplaces will continue to save money on their premiums. And consumers will be able to see the savings reflected in their premiums when they shop for coverage at healthcare.gov during the current marketplace open enrollment for healthcare.gov. So that's all that I have. I think we might have some questions.
The good news here is what you just cover answers the question that came in, what's new for 2025. So that takes care of that. So I'm going to take this opportunity to address a question that begins, why can't they just distribute a grocery card? Why do we have to go through all these stressful exploits? And so this is a good place to mention that, yes, you probably are seeing quite a bit of commercials trying to incentivize you to pick up the phone and call. The reality is that these are likely to be very specific to a location, a region, or the Medicare Advantage health plan. To be clear, Medicare is not providing the grocery card. So these are likely Medicare Advantage plans offering incentive, for you to call, but they are not available in every area. The enticement is for you to, pick up the phone and hopefully the agent on the other end could go through, what is available in your area and try to get you to sign up. Peter, am I putting that, explaining that clearly? Why, why do, folks keep seeing that Medicare is giving away a grocery card?
Yeah, so that comes in under the what do you call it, the extra benefits. So one thing's real popular, you'll have a lot of plans offering I'm trying to find my credit card here, trying to give you a health benefits card. They'll try to give you that you could use for going to the pharmacy and buying aspirin and different things. And so that can be up to 120 a month. So be careful, look, see what the offer is. It's very popular. Other things is grocery, like you were mentioning, groceries. And the other things is health gym memberships, or silver sneakers clubs. So these are all extra benefits that Medicare Advantage plans actually have to offer something extra that Medicare wouldn't normally cover. That's supposed to be helpful to your health. And these are very popular. So Chelsea will see these come the way. Hey, how come one plan has groceries and the other one doesn't? Well, it's just the plan gets to pick what extra benefit they're going to offer.
And we need to be clear that this is not being offered directly from Medicare, and
Right.
which some people are assuming that that is the case. Hey, another question for you, Peter, is I am 67 and still working full time with medical insurance through my employer. I sign up for Medicare Part A, but am unsure if there is any other action I should take.
So that was very smart to do. So now you have once you're turned 65, you are entitled to get Medicare Part A. You don't need to have Medicare Part B because you are currently working and you have a group health plan from your employer. So when you get near retirement and you're going to stop working, and that means you're going to have your health care, you won't have your group health plan from your employer, that at that point, just the same thing that Jeanette was saying earlier, 3 months before your retirement date and then 3 months after your retirement, you're going to want to sign up for Medicare Part B with Social Security. But you're going to ask them, hey, I was employed and I had a group health plan. I was actually working and receiving health benefits through my employer. That will give you a penalty-free opportunity to enroll in Medicare Part B. So you're doing everything right. And the other thing is right now, if something bad happens, let's say something bad happens, your group health plan will cover you. But sometimes if you're like getting discharged from the hospital, remind the discharge people, oh, by the way, I do have Medicare Part A. But again, only if something bad happens, because that Medicare Part A allows you to have access to benefits like skilled nursing facility care and home health care benefit. And a lot of group health plans don't have that.
So, Peter, you've covered quite a bit about Medicare, original Medicare, supplement, and Medicare Advantage. And once again, I remind folks on this call that we're not going to be able to get to every single questions that is specific and nuanced to you, which is why we are encouraging you that if your question is not being addressed or answered here, that you also have your area aging agency on aging to contact and can sit down with you and look at what your current situation is and see what plans are available in your area that makes sense for you. So got to mention that again. We did receive a handful of questions that I don't think that any one of us have a crystal ball as to what's ahead, but I would like Regional Administrator Derek Lamb to chime in now because of some of the questions that ask, well, what happened post OEP and into 2025? Derek, would you have a few words to say about that?
Absolutely, Jeanette, and thank you so much for posing that question. So during my introduction, I talk about, as the regional administrator, I manage, the stakeholders, connections, local engagement, for the different states, including Arizona. At a larger level, you may be aware that CMS is the federal agency that provides health coverage to more than 170 million through Medicare, Medicaid, the Children's Health Insurance Program, and the Health Insurance Marketplace. And we work in partnership with the entire healthcare community to improve quality, equity, and outcomes in the healthcare system. So there's a lot of unknown, but what I can share with you is the overall mission of CMS continues regardless of the administration. And CMS employees, including all of us here today joining this call, will continue to serve as the conduit for the American people to implement policy and to ensure compliance with laws. So let me tell you a little bit about what our office actually will offer. So we communicate CMS initiatives, policies, and public health messaging, just like what Peter and Jeanette and Christina and Janelle just did. We also listen to stakeholders, gather feedback, and communicate it back to CMS leadership to help inform policy. And we routinely meet one-on-one with partners to explain our work. And we also provide free education and outreach that includes presenting on certain CMS topics, just like the ones you have heard today. So these are the things that we continue to do. Because once again, as regardless of the change in administration, the overall mission of CMS continues. And we as employees will continue to serve the American people, to implement policy, and to ensure compliance with laws. So that's what I would like to share with you today. And hopefully this will address some of the questions that you may have. Again, we don't have a crystal ball, but we will continue to communicate with you if we have any update for you. Thank you.
So thanks, Derek, for that. And so what Derek just said covers a handful of the questions that were raised in the submitted in advance, as well as, some concerns. Some folks, while not posing a question, did raise the concern. So hopefully we could alleviate some of that by saying that we are hearing the concerns, we are reading the concerns, and it is part of our job in outreach to make sure that that gets communicated upwards. And so we do have a question in the Q&A that was also in the submitted in advance batch. So I want to make sure we cover that so that you don't think that we're skipping over it. And the question specifically is, our PPO Advantage plan through ASRS has raised their monthly premium by about $200 for both of us. We were told that this was because of the 2000 prescription cap. While there's a lot of talk about this as a benefit for a few, the increase seems a lot across the board. Is this just a way for insurance company to increase prices? So that's the question. And, it's fair to say that, we're not on the insurance company frame of mind, so we can't speak to, their frame of mind and their action. But my CMS colleague on this call, if you have any comment to speak to this concern, please feel free to answer.
Yes, I'm happy to answer that. So this increase in premium is likely a result of your Medicare Advantage plan, which is separate from the $2,000 yearly cap. So the $2,000 yearly cap is that beginning in January 2025, all Medicare plans will include a yearly $2,000 cap on covered out-of-pocket prescription drug costs. So that's just the prescription drug costs. So for this, you'll pay no more than $2,000 in out-of-pocket costs for your Medicare prescription drugs. And so because of the provisions of the IRA, it's estimated that about 389,000 Arizonans will save about $379 a year because of the new policies under the new prescription drug law that are taking effect in 2025. So the cap is separate from any premium increases. The cap only applies to drugs that are covered under your Medicare plan. So that's, and Peter had mentioned it before, but that is making it especially important for people with Medicare to review their plan, make sure that your specific drugs are covered. And if you have prescription drugs that are not covered by the plan you choose, then they will, you'll not be able to fully benefit from this cap. So that's why it's important to review your plan, make sure that your specific drugs are covered, compare your plan options. So consider the total expected costs under a plan, not just the premium, but also comparing your options through the Medicare Plan Finder tool, which shows your total expected costs under a plan. And also, we encourage people with Medicare to see if you qualify for other assistance programs like Medicare savings programs, the low income subsidy or extra help, as those programs are helping people with Medicare to afford premiums and out-of-pocket drug costs. So the IRA, the prescription drug law, has also expanded the low income subsidy program so that more people are now eligible for that subsidy. So about an additional 3 million people could benefit from that, but aren't enrolled. And there are a lot of other safeguards and provisions in place under the IRA with respect to capping base amounts for premiums, and then other issues like drug price negotiation for some of the costliest single source brand name drugs. Also, for certain drugs, prices increase faster than the rate of inflation. Drug companies will have to pay a rebate back to Medicare. So there's a lot of different factors involved in determining, your drug costs, which again is separate from these premium increases to Medicare Advantage plans.
Thank you, Christina. So I am looking over the a handful of new questions that came in yesterday. One of them saying, if I am happy with my current coverage, do I need to do anything? Well, if you are indeed happy with your coverage, no, you don't need to do anything, but we still do encourage you to go to Plan Finder or just to review what's new for your plan, because plan benefits change every year. So you want to make sure that you're aware of what changes will be occurring in the specific plan that you're in beginning on January 1. So make sure you do that. This next question is a little lengthy, but I think the concern is, though, I'll read the entire question. My husband retires in April 2024. He had a union job and we had insurance through the union until end of February 2025. So that means they still have coverage through the employer through next February. It's great insurance and I don't want to lose it until I absolutely have to. Why can't we sign up for Medicare in February 2025? So if I'm understanding this correctly, you're concerned about making sure you have coverage after February 20, the end of February in 2025. The thing is, if you are no longer covered under an employer plan, as Peter had stated in his presentation, you do have what's called a special enrollment period at that juncture to enroll in Medicare. Am I stating that correctly, Peter?
Yeah, the fine print being is that you have to be over 65 to be entitled to Medicare, based on age. And so that's the thing. So assuming that you're both 65 at that point, and I just then your group health plan or your union plan ends. You're no longer were actually working. Then you would turn on Medicare on your birth month. If you're past 65, because you were actually getting your health care, the group health plan through your union, you would be able to turn on Medicare penalty free because you were actually working, actually covered.
Christina, there's a new question that came in. Is there any change expected to include the pen/needles to take diabetic medication more affordable, or is included in the $35 per month?
Yeah,
Something you can answer?
Yeah, thank you. Yeah, that's a great question. So currently, under the existing provisions of the IRA, the $35 cap applies to covered insulin products. So what that means, those are products that are included in the Part D plan sponsor's formulary. So also, in addition, under Medicare Part B, if you have insulin that is delivered through a traditional pump that is covered under the Part B durable medical equipment benefit, Medicare, then the cost sharing amount for a person with Medicare is capped at $35 a month. Now, the equipment that you mentioned, the pens or needles, that's considered a supply. So it's not insulin covered product under the plan's formulary. So since they are not insulin products, those supplies are not subject to the $35 cap on cost sharing. And so they might cost more than the $35 and the plan deductible may apply. So that's the provision of the law that's in effect right now.
Thank you. So there was a question in chat asking what's the difference between Medicare Part A, B, C, and D. And my colleague Sharon did put into the chat to answer the web link for that. Make sure that, again, given time, and we may not address every single question, that you also go to our Medicare.gov website, and she had linked it in chat. There are a handful of other questions, specifically, will we lose Medicare in the new administration, or when will there be Medicare for all? Once again, I want to bring your attention back to what our regional administrator, Derek Lamb, said. We don't have a crystal ball. We only know what we know in terms of what we have to work with in terms of maintaining existing laws and policies. But if you do have a very strong opinion or concern about how it affects you, that you speak to your congressional representative and let them know where you stand, because that's where any changes or the start of any policy change has to begin with them hearing from you. I'm cognizant of the time. We are down to the last 6 minutes and want to make sure that I get through everything that is left in terms of the question.
I just want to add, Jeanette, as you referenced a couple of times about the local area agencies on aging, and that's the best resource that you have locally at where you live, to provide you with the local resources, so that if you have questions, whether you have information need on Medicare or Medicaid, or whether you need something else like a home care, hospice, nutrition programs, home delivered meals, transportation, legal services for seniors, supportive services such as adult day health, program of all-inclusive care for the elderly, those general questions. All these local area agencies on aging have trained staff who actually are well-versed on all these local resources. They can support you. And of course, just want to reiterate what Jeanette mentioned. You can also approach the district office of the congressman, and if you have any specific concerns or issues, they can help you to address.
with the time remaining we have, there is one final question in the Q&A. My husband is 66 and still working part-time with insurance, but is looking to retire soon. He has not signed up for Medicare. What would be the best way to do so? So if he currently still has insurance coverage, you're fine. Although we have always encouraged folks that if they're 65 to sign up for Part A, because if you paid into the credit and work 10 years, it's provided to you without charge. So we always encourage folks to turn that on when they're eligible. And when he's ready to retire and will be without employer coverage, make sure you reach out before that ends to turn on Part B, so that there is, hopefully no gap in any type of coverage. But that would take some planning to make sure that you coordinate, when the separation from that employer, and then when the Medicare coverage begins. So Peter, if I've answered that correctly, or if not, please chime in, but that would be the last questions that I think we have time for.
And Chelsea also reminded everyone that Medicare enrollment is actually handled by the Social Security Administration. She has also put the link for everyone to look at in case, you have not done so. So
Yeah.
Thank you, Chelsea.
Thank you.
Yeah, thank you. Well, Peter, Jeanette, Derek, Christina, Janelle, and Sharon, thank you so much for spending this time with us, and everyone who's still on the call and hanging tight with us. Thank you so much. We hope that you found this to be helpful. I know I learned a lot. And echoing what Jeanette said, these folks really are the subject matter experts, but Congressman Stanton's office is always here to help. We're here to help you, connect you with resources, and make sure that you have the information and resources that you need to navigate some of these very complex and nuanced systems. So please do reach out. I put our phone number in the chat. You're welcome to send an email. And if we can provide any follow-up resources, please do call us and reach out. Any final thoughts or words from anyone before we end the call?
Again, just want to thank Congressman for inviting us and Chelsea for hosting this webinar. Once again, the overall mission of CMS continues regardless of the administration, and we as employees who continue to serve the American people, to implement policy, and to assure compliance with the law. So thank you so much.
Yeah, thank you. All right. Thank you, everyone. Take care.
Hey,